Welcome to all who are participating tonight in regards to how we're optimizing the use of IlluminOss in primarily in proximal humeral fractures. Got a little bit of housekeeping and some reminders to go over regarding the use of the IlluminOss device in the humerus. One of them is that, as always, with any fracture or implement to fix or stabilize fractures, we really need to focus on adequate reduction of the fracture and stabilization. And so we always want to achieve good anatomical relationships and restore the morphology based on direct visualization of the fracture if you're using an open technique, or the fluoroscopic or radiographic reduction of the fracture if you're using a more percutaneous technique. And I think we're going to cover all of that tonight in various formats. But and of course, we want to achieve stable fixation, and we need to use our clinical judgment in regards to the personality of the fracture, the type of fracture, its orientation, as to how to best achieve that, all with paying attention to preservation of the blood supply so that we can get adequate healing over time and minimizing the trauma to the surrounding tissues. Ultimately, I think for fractures in the metaphysis and juxtaposed to joints, we really want to eliminate or minimize any type of post-operative immobilization and promote early range of motion. And that's, of course, one of the things that the IlluminOss device, with or without the use of adjacent implants, allows us to do, as long as the sizing is appropriate. What's important in the humerus is that we determine the size of the intramedullary canal, because in order to use the device properly and achieve stability, we really need to make cortical contact with the device. So there's different ways of doing that. Probably a combination of ways is the best, but you can utilize a ruler overlaid on the fluoroscopic image or preoperative image to try and determine the inner cortical diameter of the bone so that you can utilize an implant that will fill the canal. If you're unsure of the magnification, as you see here in the center slide, we know that if you put something in of a known size, so the introduction sheath for the IlluminOss device, depending on the size of the device that you're using, is a known size that you see down there. It's either 4.5 millimeters, 5.5, or 7.0 millimeters. And you can determine that at the time of operation. You can use that as a reference point to determine the actual size of the inner diameter of the canal. But ultimately, we need to ream away any debris so we can achieve cortical contact with the reamer. And really what we're looking for in principle is the greater the diameter of the implant, the greater the strength of the implant. And the minimum size to be used as a standalone implant in the humerus is a 13 millimeter diameter. So if you're going to use the device without augmenting it with additional fixation, it needs to be at least 13 millimeters in diameter. And don't forget that the diameter of the humerus tapers as we near the end of the humerus. So just be cognizant of that. And here you see that representation. And essentially, when you go below 13 millimeters, the stiffness and strength of the implant falls below a critical yield strength, and that's why you need to augment it with additional fixation. So ultimately, what we want to do is we want to make the implant achieve cortical contact. So we need to ream away some of the residual intramedullary materials that might prevent the implant from expanding fully. The implant is designed with a radiographic spiral marker in the implant that's initially compressed. When it's fully expanded, you won't see any of the kinks in the device. And so you can see here we're lower in the humerus. We haven't achieved full cortical contact below that arrow there. And that would be a representation where we haven't expanded it to the degree that we want to, and probably would require a bit more reaming to achieve that. So just be aware of the relevant language in the technique guide. I'm not going to go through all of this, but in summary, you need the device to make cortical contact if you want to use it as a standalone device. And in the humerus, 13 millimeters is the minimum diameter of cortical contact that's required to be used as a standalone device.